Good morning, everyone. My name is Jo Yoon. I'm a fourth-year resident in Asan, and today I'm gonna share the experience I did on April 25th to 30th. And I went to Kyrgyzstan in a mission called Asan in Asia with Professor Peter Saul and Professor Hyunho Han. So I'll first introduce our team who went together. This is Professor Peter and Professor Han, and this is the company MediThinkQ also came with us. They brought a new updated version of the 3D exoscope in order to donate it to the Kyrgyzstan. And this was the company member. And one member of our hospital, she's a oversee department, and she came with us to see how it works and why we need to go to Kyrgyzstan, not bring them to Asan. And this is Dr. Rustam, who took care of us for the whole week during the stay. And this is the president of the Kyrgyzstan Plastic and Reconstructive Surgery Association. She also helped us a lot. So this is a brief timeline of what we did. We arrived in Kyrgyzstan on Saturday, and on Sunday it was just a resting day to check out the hospital and have some lunch and dinner. And we we went to the hospital on Monday through Wednesday, and we had one cases each on Monday and Tuesday. And during the surgeries, we also had outpatient cases for which we did the clinic together with the Kyrgyzstan doctors. And on the last day, we had the micro workshop to train the Kyrgyzstan residents and Kyrgyzstan doctors, and we did some ceremony with the donating ceremony with the Shia company. So why did we go to Kyrgyzstan? Well, actually, Dr. Rustam from Kyrgyzstan met with Professor Peter, and they had a strong desire to learn the reconstruction, micro reconstruction in the plastic surgery departments in the Kyrgyzstan. And Professor Peter thought they really needed the knowledge and the skills. So we told the hospital to get some money and help for the mission. And also, this is a real operating room, operating theater we went. And this is the hospital we went. And if you see, there's a lot of difference from Korea and other parts of the world. And this here is the microscope. It's over 40 years old. So we cannot really see clear through the microscope. And this is the toilet. And even the toilets are really not good. Only one toilet for all the doctors. And if you see, this is the anesthesiologist. He is a very good anesthesiologist, but if you see the instruments, it's really different from ours. And this is a typical patient room. And you can see that there's no curtains, there's no anything. The bed is just a flat bed. So this is just a brief introduction in the healthcare in Kyrgyzstan. It's basically a public sector based system, and the government pays the national hospitals to treat the patients. But even the patients, no matter how much they are admitted, no matter what surgery they get, they have the maximum payment, and it's even the surgical patients have about $100. So the hospital are really poor, and they don't have really money to get the real treatments for the patients. So this was the hospital we went, and this was where we stayed, and it took about 10 to 15 minutes walk to the hospital. So on the first day of the hospital, on Monday, Professor Han gave a lecture about the breast reconstruction. And in the outpatient clinics, all through the stay, we saw a lot of patients actually. There was a lot more surgeries we had to do, but some schedules changed. This was a kid, we did a forehead flap last year from Professor Choi. And this was a deformity patient of the hand. There's a defect after radiation, after excision of the cancer. There was another delayed patient who came to the clinic. And there was a trauma patient who needed at least a free flap for the lower extremity. And this kid had a whole scalp aversion. And this kid is actually, we are trying to get a plan for him to come to Korea and get a further reconstruction and treatment in here in Asan later. And this is another patient who had who needs an eyelid reconstruction. So there was a lot of outpatient clinic patients who really needed the reconstruction they couldn't do. So on day one, we did a delayed breast reconstruction we planned it for a pedicle tram, actually. So we could do a DIP, but we thought that it was too dangerous to do it, because in order to do it on the IMA and IMV, there was a possibility of, if the artery and vein got ruptured, we can't stop the bleeding, because there was not good enough Bovie and unipolar electrocardial system, and even the suctions didn't really work that well. So this was some photos of the surgery, and I will show you some photos of the surgeries. So on the first day, we did the breast surgery, and as you can see, the operation theater is really big, but there's not enough people. And there's one really who looks like a really master of the surgical instruments. It's only one scrub nurse, but we had trouble talking to each other, so I had to do the scrub works, and it was a really nice experience. And as you can see, we used this exoscope called SHIA to try to super drainage the SIEV to the thoracodorsal system. And actually, the surgery went really great. This was immediate post-operative photo. And this was the next day when we did the dressing. The patient, the pedicle tram went really well. And we had successfully done the surgery. This is the patient. And this is actually 1 week after the operation, and it was really nice. On the second day, we had the chance to operate on this is a congenital case. She had this amount of alopecia congenitally, and last year Professor Jung put a two expanders on each side of the head, but unfortunately one expander ruptured, and we had to do the surgery in advance. And there was this expander. We removed the expander, and we tried to cover the defect with the inflated side and also the side. We successfully managed to just close the wound. And she looks much more happier than the photo, but she's much more happy. And on day 3, we had no surgeries. The surgeries was canceled, so we did a micro training with the local doctors, and with the Scope-I system, we could do some anastomosis, and it was a really nice time. There was also a video, just short video. So it's inside the ward, and yes, we did this kind of workshop. And also, lastly, we did some, there was a ceremony, and the company, Shia company, MedithinQ, happily donated their one of the microscopes to this hospital. It's not cheap, but they did the donation, so we were very happy. We were very thankful. They could get the Shia microscope, so they can do more microscopes, microsurgeries. So we weren't only in the hospital. We had lots of great foods, great meats, and these were some foods that the local patients gave it to us. And actually, there was this one patient who brought a really nice, delicious foods to the hospital, and she was a patient. We did surgery last year. Professor Hyung-baek Kim did the DIP on the right side, delayed reconstruction of the breast, and she was really, really happy with the result. And we can see that the result is really nice, and even the belly button is really nice. And actually, I want to show you some videos with this pet drone that Professor Han brought with us. And this is the real photo and video that we took with the drone. Professor Han took with the drone. And we can see that, yes, this was a place we went on Sunday for lunch. It was inside a mountain. We had to ride for about 2 hours. And it was really nice. So I learned that the drones are really, really nice actually, because they can do a lot of stuff like this. It's a automated turn that they took. And so, yes, I just want to show you some.
Not sponsored by the drone company.
Maybe he is.
This is a picture we took with the drone. Inside, yes, I was really inspired by the drone technology. Yeah, so this is the hospital. We took inside the hospital, actually. So well, I'm not okay. All right. So this medical trip was really a grateful experience for me. It was a really nice opportunity to see inside the world, actually, to go outside the hospital and see the other parts of the hospital. And I want to say I'm really thankful for the professors, and especially Professor Seo, for bringing me into these really great experience. And I want to say that there are many more patients waiting for maybe the other professors or other residents, because we are planning to go again on September. So I just want to tell you that even though Kyrgyzstan is not really developed country, we can learn really a lot from just going with the hospitals and seeing a lot of differences. And also I learned that the hospital is always saying, just bring the doctors to our hospital to see the surgeries, but they don't understand why we need to go to the Kyrgyzstan. But I learned that we need to go to Kyrgyzstan and stay in the operation room in those hospitals and feel the environments, feel the surgery instruments with ourselves to know what difficulties they have, the doctors in Kyrgyzstan. So I think going to other countries for these medical volunteer is really important for us. And thank you. Thank you for listening.
The reason we did medical trip was that the thing, because in Kyrgyzstan, the reconstructive system itself is not well set. So we wanted to do the easier surgery and let them train with those surgery first and make it popular for all the general people to know that the reconstruction is really helpful for their quality of life. So luckily they did first free flap in that the National Hospital last year. They did ready up one free flap with the Shia microscope. So I think the change will be slow, but it will be really important for them, with their Kyrgyzstan doctors and also for the patients. Okay, thank you. Any comments, questions? 네.
감사합니다.